Hi, welcome to our fireside chat with Ryan Kelly and his wife, Emma Kelly. We're here today to talk about maternal, child, and women's health. My name is Dr. Tiffany Inglis. I'm the Chief Medical Officer at Elevance Health. And as many of you will know, Ryan knows a lot about football. But what you may or may not know is that Ryan and Emma both know a lot about maternal and child health, and through some unfortunate circumstances have really become champions of this work, and would love to introduce our Elevance Health Foundation champion. In 2024, Elevance Health asked you, Ryan, to become the Elevance Health champion because of what your tie is to the maternal and infant health experience and space. Can you tell us a little bit about that partnership and how you came to be in that space?
Yeah, I would say, first of all, it's an incredible honor to be here. I hadn't much knowledge prior to this, but then I started looking up the previous winners and some pretty incredible names in there, and a lot of people who've done tremendous work in their communities, for different advocacy issues. And certainly this is what, this is our calling now is, helping especially women to not have to go through the experience that we did. We know that it ultimately shaped who we are. Our outlook on life has all changed since then. But it's been an incredible honor for us to do this. So I'd say, kind of the beginning point was when we lost our daughter. Count the Kicks and Elevance Health were both there to pick up the pieces when we lost her. You feel so helpless in those times, and for them to be there for us. Elevance is a huge company, and Count the Kicks as a relatively new startup foundation to help women to monitor third trimester baby movements. Really just, it kind of put like a warm blanket around us at the time, right? It's like, hey, we're here for you. Even though you are this professional football player on a big stage, this is kind of our expertise, and like, let us help you. And so now to be, given this award, it really just goes to show that, in what we've been able to do, Emma and I, and sharing our story with correlation with, big companies, with people that have gone through the same thing that we've gone through, with Count the Kicks, who's been such an emotional and rock star for us, worldwide, nationwide, helping babies, helping mothers to give back and to make sure that nobody leaves the hospital empty-handed the way that we did. We just couldn't be happier, and it just ultimately was, kind of the road in this life in this NFL was always trying to figure out what we wanted to be passionate about, or what we were such a big stage. How do we give back? And this is ultimately kind of our destiny and is our path for us, and we just love it and have found so much solace in it, from healing ourselves, healing other people, and to hear these success stories of babies being born because of the action that these companies have taken, and Count the Kicks has helped us with.
Yeah, thank you very much for that. That's really important work. And Emma, can I ask you, tell us a little bit more about your story? You can tell us why maternal health is important to you, is a personal experience to you, and what got you here.
Yeah, absolutely. When we first started the journey to being parents, we were so completely clueless. You don't really hear, or we hadn't at the time heard about anything truly negative. We were certainly familiar with the term miscarriage, but certainly not stillbirth, until we were sitting in that hospital, and the hospital, our doctor told us that there was no heartbeat, and that we were too far along, and that we would have to go on to deliver her. And so everything changes in an instant. Your world shifts, and what's the happiest chapter of your whole life turns into the biggest nightmare you didn't even know existed. So you have all these feelings, especially as the birthing parent, shame, isolation, just all of these really, really heavy feelings and questions. Did I do this? Did I cause this? All of these things sort of opens up, and that is where companies, when we opened this up, Elevance started to come in, and Count the Kicks came to our rescue, and then this community, this beautiful, heartbreaking community, came to our rescue to let us know that we weren't alone. We started hearing so many stories, heartbreaking stories of people in similar situations. And so it was at that moment, we realized that there's a really big opportunity. And we realized that the conversation about stillbirth and loss and maternal health, because those two go hand in hand, by the way, to back up, a lot of maternal health issues and stillbirth go hand in hand. And then certainly after traumatic birthing situations, we have to worry about mom and make sure that she's taken care of. And so it's a really big conversation and we should be talking about it. And in that moment, or sort of in those first few moments, we realized that there is just a huge opportunity for education so that, as parents, if you were in this situation, just to be better prepared, to have more information, how can we help with that? So you don't feel like you're on this island by yourself, which is where Elevance and your guys' resources really come into play. And then we find out that there is beautiful organizations such as Healthy Birthday who created this app called Count the Kicks that helps women. It gives them a voice in their pregnancy and in their birth. And it gives us evidence. It gives us all the data and just this empowerment to take control of our pregnancy and to start to mitigate these risks, especially loss. So when we learned of this, we knew that there was no going back. We also are so blessed, Ryan is so blessed to have the platform that he has. So while we're in this, how can we explode the message and education to help and empower parents who are expecting so that, like Ryan said, no one walks out of that hospital with empty hands?
Yeah, it's such important work. And I do think so many people feel so alone in that moment. And there is this feeling of like, what did I do? When so much of it is not under your control, right? But you need to hear that and you need to know it. And I think that's really an important message that you get to carry. And I think having that experience and being the one to share it is so meaningful to so many people experiencing the loss that you guys unfortunately had to experience. In that time, you made some posts, I think, on social media about Mary Kate from the hospital and really probably a huge risk you took to sort of share that just raw feeling that you were feeling. And, how did the community respond? How did that help you or help, to help lead you down this path?
Yeah, it was 2021, and we were ready to play the Patriots at home. And people that know football know that it was a very rich rivalry for many years with Peyton and Tom Brady. And I was, listed as personal issue out for the game. And people don't know what's going on. They, speculate, whatever. So we really posted it just to let people know that, like, I'm not bailing out of this game. Like, this is the worst day of our life, right? In the midst of the hospital, we couldn't have had more outpouring support from ownership, from, and the NFL can be a very cutthroat business, but in that moment, it was like the whole city was like wrapping us in a glove, right? And that felt amazing. So we wanted to, share this just to put it out there. Like, look, like, we want some privacy. Like, can you just, like, we're going through our thing, right? And in that moment, like Emma said, you're sitting in that hospital room, like, you're the only people that, like, it might as well be an empty hospital. That's how it feels, right? And, in the hospital, people that we dealt with tried to shield us from hearing other babies, right? Because, like, they just know how sensitive of a time that is for you and how anything could really trigger an event. And so I give them so much credit. And in that moment, we shared it. I don't think at the time we understood what we were doing. It was just like, hey, can we please get some privacy? And in doing so, created this beautiful nucleus of families and people reaching out to us in support and sharing their stories. People that hadn't shared their stories in 30 years, had never told anybody about it. Because at the time, all we know is we're going to these appointments, we're coming back, we're excited, we're doing cribs, we're looking at names, and then next thing you know, it's gone in an instinct, and we're planning for a funeral. And like, how did we get here? And in doing so, when these families start reaching out, it's like you feel like you're the only people you want to talk to are these people, because in the moment you feel so alone. And now there's somebody out there throwing you a life raft, and it's like, oh, there's people that have gone through this as well, right? And so, we threw that out there, and stories come flying in from all over the country, and then newspapers pick it up, and it's it's going global, and it's like, it's honestly, you can see in weeks after meeting people, you can see the weight just like coming off their shoulders, because they've been living with this. They never thought they could talk about it. And now that this NFL player and his wife are up there talking about it, and they're being vulnerable enough to mention that, this was a tragedy. I mean, it was awful. It's the worst thing in the world, is losing a child. And now being an advocate for it, I think it's just kind of full circle. But But in the time, I mean, and that's why we love the city. We love how much we've been able to help worldwide and countrywide, and especially here in Indianapolis, is they've, at the time when we were at our most vulnerable, they helped us. And that really means the world to us.
Kind of building on that, what then led you, Emma, to sort of go down that path of being an advocate for infant and maternal health? How did you find this particular pathway?
So I think I touched on it briefly. We knew once we got to sit down with Emily Price, the CEO of Healthy Birthday, and those behind Count the Kicks, there was no going back. There was no way about something so critical, so amazing, so powerful, and walk away from it. So it was twofold for us. It was one way for us to continue to keep the spirit of our daughter alive. And so it was a way to continue sharing her story, one, just in her honor, and then in two, to help others to resonate with those who need it and to connect this community that so desperately needs that connection and understanding. And so the other part of it was we have an opportunity to save lives. What's more meaningful and powerful than that? When given the opportunity to help someone to get this out there, and by doing so, we may help parents walk away with their children. And if we can help in the small way, even if we just save one life, that in itself is so worth it to us. So, it's not lost on us who my husband is and the access that he has and the platform. And it's, let's do something. Let's help change the world, or let's even just help change Indianapolis if we can while we're here. So it was a no-brainer to us. And I do say that too. I think one of the things too is when you lose a child or there's this feeling of, I have to do something. I have to, I just want to say too, like, just living and carrying on is enough. And that's enough. Like, that carries your baby on. As long as you're living, you're carrying your baby. So I don't want it to feel like you have to do anything, but it's like, it came to us. It was a no-brainer, and it's enough. But if you or someone is going through this and you just help us share the word of, hey, there's a free app, and you could get to know your baby better and really bond with it in the third trimester by counting its kicks, and bonus, it'll teach you that if anything's off to go in, it's like, that's enough. It's so great. And if we can start with just that it feels small, it's going to have a major, major impact.
Yeah, I think it sort of leads to another question too, of it's incredibly important to monitor your fetal movement, and incredibly important to understand how and what that means, right? And then, we've put this into different tools at Elevance Health within our maternal child programming, because we as well agree that it's very important to feel that empowerment or that ability to really understand what that might mean to you, your pregnancy, and then to message it, right? To know who to call, to know what to do,
Yeah.
right? Like, that's the other thing, is you can do it, but if you don't know what to do, it sometimes is hard to know what to do with that messaging. But what other resources do you guys think are essential for expectant parents? That this has obviously been such a huge positive impact, having fetal monitors and being able to have moms monitor that, track it, use the app, then message it when something's not right. But are there any other resources you think are really vital that you guys found to be helpful in this experience?
There are so many, but one of the things when you were talking about this that first came to mind, and it leads back, but I think right now, what we've learned through going through this is that people want to help. Doctors, nurses care, and they want to help. And I like to say, like, get cozy with your care. This is such an important and incredible experience. It's one of the most magical, if you wanted it, expecting a child. And of course, there are some concerns and some scares, but you should get to a place where you feel comfortable with your care and with your providers and with your doctors and nurses. And I think a lot of the things that Ryan and I have heard, and we felt ourselves going through this journey, is that women and partners feel scared to speak up. And it does not have to be that way. It should not. This is a two-way conversation, and you have a voice, and it's important, and almost all are willing to hear you out. And so what we also want to say is, can we change this conversation? Can we bridge the gap between the providers and the patients, so that people understand that it is a partnership, and you need each other. And so I would say the biggest revelation in all of this is to talk and not to be afraid. So many times we hear patients who are on the loss side of things say, I felt silly. I didn't feel comfortable. I didn't feel confident. I was afraid I'd be like a burden going in. What if I go in and it's nothing? I'm going to feel embarrassed. And I think we all agree. I think doctors especially would agree. Who cares? I've heard so many times in my journey, I would so much rather you sit on this table and us say it's nothing than the adverse effect. And so I just wish we could start opening up that conversation, is get comfortable, get confident, and just have these conversations. You're not a burden. This is why you guys are doing your job. You want to help, you want to care. So that's what we're trying to do too. And is just change the conversation and narrative to create a really positive relationship between the two.
Yeah, it's really important. I mean, people need to feel valued and heard, right? Wherever they are, whatever they're doing, but especially in this most important journey of your life, oftentimes for you guys, even it's your first child, right? And you're bringing your first child into the earth, onto this planet, right? And you want to feel valued and heard. And I think it's important. You have to communicate, but you have to feel welcome to communicate, and you have to feel heard. And I think that's really, really important. What keeps you dedicated to this, and what keeps you going? How do you keep this as a top priority with multiple children now that you do have, and very busy careers and lives? Like, what keeps you moving towards this goal?
I think it's a couple different things. For us, speaking about our daughter, at a certain point after we lost her, we couldn't have done it, right? And we failed a lot of times of how we grieved, of how we saw the world, and it was really tough. I mean, it was like we sit here today in a much different space, much different light than when we were after we lost her. And it wasn't, without the community that we have, without, Sad Dads Club, who I found, who I've sensed, many people that I've come in contact with for fathers. There's a lot of stuff for mothers, but not as much for fathers, right? And we're just as important, and we grieve differently. And understanding that has been, an enlightening experience in itself. But what keeps us going is, it honors our daughter. It keeps her alive in our hearts. And we always know that she's with us, right? And I think it's very important for us. It's the community that we never wanted to be a part of, but we're so glad that we are, because the people that we've met, we feel like have been able to shape how we look at our lives now, how we help other people. And earlier today, a family was here with their daughter who used Count the Kicks at 35 weeks, when she felt like she didn't feel something in the morning. She felt irregular, and she was an advocate for herself. Like, she heard about the app either through social media or another venue, and she downloaded it and started using it. And then sure enough, it might have happened on a Monday, and she's supposed to go on the next day. And she went on a Monday, and they said, your baby's not doing well, emergency C-section. Now the baby's here. And so it's like, you hear these cases, and we stay in touch with as much as we can with all the kids now, but you save one baby, and it's like, that's so worth it, right? And it makes us so happy to be a part of it. And we've always, like Emma said, we were looking for so long for what our connection was going to be to the city, or what we do to give back, and we give back to a lot of different ways. But this is, so close to our heart, and such a remembrance for our daughter and for all the things that we've been through together, and to where we are now. I think it's just, it'll forever be our passion project.
Yeah, it's wonderful. I think it is truly important to remember the dads, right? It's a family experience, and there's so much there. As you guys have said before, you're preparing a nursery to then come home and plan a funeral, and that has a lot of impact that ripples throughout your family and your community. And what you guys are doing to help ensure that people don't feel alone in that is really important. Is there anything else that you guys would want parents to know as they go down their journey in their pregnancy path?
I think for me, we touched on it. Empower yourselves, educate yourselves, create a connection that feels right for both in your experience with your care team. And just the most important thing is you have a voice and trust your gut.
It's really important.
Yeah. I mean, I say that like we're not trying to scare people, right? It does happen. I mean, ignorance was bliss. Our first, like, you ask us after we lost our daughter, the pregnancies after, every weird feeling or, like the ignorance is bliss when we lost our daughter. We don't get that back, but we understand, we try to take it one step at a time when we're pregnant. It's like, this is such a beautiful miracle, right? And so I think for us our message to the people would be just, be aware, but like, also enjoy it. Like, it's such a beautiful gift that you get to grow this together. And now that we've got 4 kids with Mary Tate being in heaven, it's the best thing in the world, right? And obviously we miss her every single day. And I think that we look at our life a little bit differently now with these kids, and all the things that we've gone through and the people we've met along the way. I think we look at life a little bit differently through a different lens. And I'd say most lost parents do, right? You're never the same after that. And you just know that there's another person waiting for you at the end, right? So
I do want to add to that too, is so much of it pregnancy can feel overwhelming, especially in your first. And we sit here like, it is so exciting. And that's what this doesn't have to be scary. And that's why we use the word empower. It's such a cool way. Count the Kicks as a resource to really help you bond with your baby first, like learning their patterns with your partner, like letting them in on that is so special. So it's not scary. It's not another task, or it's nothing to overwhelm you. It is just another piece and way to bond with your baby. And should something happen, you are prepared. And so that's the message is it doesn't have to be scary, overwhelming. It can be really powerful and educating and a really sweet way to bond even before your baby's here.
Yeah, I think that's a perfect way to end this. And thank you guys so much for this conversation and sharing your story, right? I mean, this is a lot, and we appreciate it very much. And we appreciate all that you're doing for the community. And we appreciate the partnership and really appreciate the fact that, Elevance and Count the Kicks and you guys as our champions can really be partnered together to share and raise awareness and provide resources to people. So thank you.
Thank you so much. And thank you for all you're doing.
yeah.
Very welcome. Thank you. And thank you for joining us today. It was so wonderful to hear about Ryan and Emma's story and the wonderful strides that we're making together towards women's and children's health.